Welcome back to KimFoot.com. This is Dr. Kim again. Today we're going to talk about 3 powerful non-invasive foot doctor's remedies for heel pain epidemic. The first one is taping. Now, I told you how to tape your own foot now, a self-taping technique, but this is professionally done now. So this is taping. They're high dye taping versus a low dye taping. The only difference is high dye meaning above the ankle, which limits the motion of the ankle joint, which take pressure off the heel. So this is the only kind of taping that I use is high dye taping. This is a technique where I put a little skin tape around it to protect the skin, and I'm going to put the anchor tape, remember the anchor tape that I put around the heel area, and then I use basket weaving 2-inch tape around the bottom of the heel, and then I use the top anchor tape to hold the tape together. I tape it once or twice a week for about 3 to 4 weeks, and this really helps taking pressure off of it, calming down the inflammation, really helps the patients quite a bit. Second one that I use a lot is called the custom foot orthotics. This is for the extreme foot type. We talked about the flat foot condition or high arch foot condition. Very extreme type of foot requires a custom devices. So there are many different ways we cast the device. So we use this box to take a mold of your feet, or we use the plaster material to capture your what we call a neutral position so that we can balance. Remember the 3 legs? The 3 legs have to be perfectly balanced for your foot to be functioning properly. There are quite a bit of modification you can do for the different orthotic devices. This is called the medial phalange. So a lot of flat foot people require more support on the arch area, so we use this type of modification. And this is for the high arch foot people. We put a little indentation to balance the front part of the foot so that it doesn't rotate or it doesn't collapse into certain areas. So this type of modification is for the high arch foot people. Sometimes we make devices that are very thin. You can see a lot of ladies like to wear tight shoes, so we can modify it according to their shoes that like to wear, and then the foot type, and also your weight issue, so that we can use different materials and different modifications to make your orthotics more comfortable for you. In general, younger people tolerate more rigid devices, and if you're over 40 or so, you cannot really tolerate really hard, rigid devices anymore, so we make it softer device that can be accommodated in your shoes as well. And also, for this type of orthotics, it takes about 2 to 4 weeks to break in and get comfortable. Initially, you're going to have a lot of knee pain, back pain, because you're adjusting into a new position of walking, so it's important for you to get slowly adjusted to this new set of orthotic devices. The next thing that your foot doctors will probably do is to refer you out to get some therapy, whether it's in-house or referring out to a therapy place. They have a lot of therapy modalities that would really help stimulate the circulation into the area, such as electro-stimulation. It's not diagnostic ultrasound, but the ultrasound is a deep heat into the area to get more circulation into the area. Sometimes we put some cortisone or any kind of anti-inflammatory medicine into the ultrasound, so that anti-inflammatory medication can penetrate into the area to decrease the swelling on this area as well. You can also get the professional massaging done to get more circulation, and also stretching. And there's this brace called a nice splint that I use, very, very effective. This is the first thing that I give to my patient to really stretch out on a daily basis. I use it about 30 minutes a day to really stretch out the calf muscle so that it takes tension off the plantar fascia at the same time. We're going to talk about the invasive foot doctor's remedies on the next video. We'll see you there.